Hello, everyone, and welcome to Lung Cancer Canada's webinar series. Thank you for joining us today. Today we are presenting Nutrition, What's the Recipe for Success with Chloe Rouleau. Chloe is a registered dietitian who completed her Bachelor's of Nutrition Sciences at the University of Ottawa and went on to complete her internship. She currently works at the Shirley and Jim Fielding Northeast Cancer Center, and she's been in the oncology field for 5 years. Welcome, Chloe.
Thank you. Thank you very much for having me, Michelle. And I thank Lung Cancer Canada for inviting me to present today. It's a topic that is very near and dear to me, and I'm excited that you all took time out of your day to log on to listen. Now, whether you yourself are an individual living with lung cancer, or perhaps you are a friend, or a family member, or a caregiver of someone living with lung cancer, regardless, my hope for today is that you all leave with a little bit of gained nutrition knowledge and some extra confidence as far as fueling your body well during your cancer journey. The topic today is what is the recipe for success? We'll be diving into a few different topics regarding lung cancer and nutrition. Excellent. All right. So just highlighting a few of the learning objectives. Again, like Michelle had mentioned, of course, if you have any questions throughout, I'd be happy to answer them all at the end. So to get a sense of where we're headed today in today's talk. Number one, we'll be learning about the general importance of maintaining lean body mass and an overall healthy weight following a lung cancer diagnosis. Following that, just gaining a little bit of a better understanding of the role that nutrition plays in both supporting a healthy weight, but also, again, that lean body mass, which is a big focus of today's talk. The role of a dietitian is not always fully understood by the general population. And I think that it's important for everyone, leaving today's talk to just have a general, better understanding and idea of what a dietitian does. And again, this is focusing in the oncology field, but how a dietitian can support someone living with lung cancer who's going through treatment and accessing dietitian services wherever you are. There we go. Now, a topic that comes up often in conversation is weight. And I'm asked by many people, why does this matter so much? Why is there such a focus on weight when we're talking about a lung cancer diagnosis? And the reality is that there are many reasons why weight is discussed. But one of the really important things to make note of is that our weight is a factor that can impact our treatment options. So, of course, when someone is initially diagnosed, they'll be meeting with their oncology team. They'll be talking about what their treatment options are. And reality is there are many factors at play here that will influence which treatment options are best for that individual. And the reality is there are some factors we don't have control over necessarily. Things like our disease stage, how advanced our cancer is at time of diagnosis, our medical history, our age. We don't have control over these things. However, on this slide, I've highlighted performance status and unintentional weight loss. And the two really do go hand in hand. And I think it's important to highlight that these are some factors that we do have a certain amount of control over. When your doctor or someone who is part of your medical team is referring to your performance status, essentially that's asking the question, how fit is someone for treatment? The difference between someone who is active, who has a good amount of lean body mass, that muscle mass, who is physically more able to tolerate the side effects of certain treatments, whereas someone who perhaps has lost a significant amount of weight, whose body is more deconditioned, is more weak, experiencing more fatigue, the reality is that individual may not be able to withstand the stresses of certain treatment options for their lung cancer. So I think it is important to realize that weight and performance status are very much go hand in hand, and can absolutely make a difference in our treatment options as well as our cancer trajectory. All right. Now, when we compare other types of cancers, and of course there are so many different types of cancers out there, but when general rule is when we're looking at different types of cancers and we're comparing it with lung cancer, we do know that lung cancer is associated with a higher risk of malnutrition. Now, malnutrition oftentimes is paired with unintentional weight loss and muscle loss, and these are some of the main nutrition problems that we can face following a lung cancer diagnosis. Now, malnutrition itself, it can be described in a few different ways. In general terms, I'm talking about a state where someone's not able to fuel their body well. Either they're not eating enough or enough of the right types of foods, or maybe their body is just not utilizing that energy the way that it did before. And that can kind of cascade and lead into other problems, such as that unintentional weight loss. So, weight loss, which is occurring without trying, and that muscle loss that is paired with it. Now, these nutrition problems, they can occur at any stage in the game, whether it's prior to our diagnosis, like leading up to that diagnosis, which unfortunately is a very, very common occurrence for individuals with lung cancer. The last statistics that I saw showed that up to 75% of individuals will experience a significant weight loss in the 3 months leading up to their actual cancer diagnosis. So sometimes we are starting our cancer journey a few steps back, given the weight loss and the muscle loss that we've already experienced. But weight loss is a common problem that can occur at any point throughout treatment and even after treatment. So I think these are very, very common problems. And of course, there are things that we can do to minimize these issues. Now, I wanted to highlight the muscle loss and dive in a little bit more into this in particular. Because oftentimes when we're talking about weight loss, it's a combination of muscle loss and fat loss, fatty tissue. The muscle loss is where the true issues lie. So when we look at a healthy body, when we look at ways of promoting good health, we know how important having that lean body mass, that muscle mass, it's very, very important. And when someone is going through a period of illness or injury, for example, a lung cancer diagnosis, it's very, very common to experience that muscle loss. Now, when we think of our muscles, when we think of the muscles that make up our body, we see on this image here, all the red areas are highlighting our big muscle groups throughout the body. When we think about our muscles off the top of our head, oftentimes we'll think of things like strength, our balance, our mobility, movement, right? But we oftentimes forget how important our muscles play in our immune system, how our immune system works, and also our body's ability to heal and recover following injury and illness. So muscle loss can happen for a number of different reasons, but when we're looking in the cancer world, muscle loss can happen very, very quickly, and it can be associated with a lot of, I don't know what's going on here. I don't know if we can head back. There, you guys got a preview of what's to come. But kind of going back to, Don't know what's going on here, Michelle.
Yes, I'm trying to get back the controls. Here we go.
Okay, sorry about that, guys. While Michelle is figuring out the technology piece, I'll continue on. Essentially, I just wanted to highlight with significant muscle loss in individuals with lung cancer, it does come with a number of different health complications. Okay, generally for people who've experienced more muscle loss or muscle wasting, we will notice poor lung function, okay, which is a big one. Quality of life can be significantly affected. Our mobility, the way that we are able to move, which again is really tied into that quality of life. We tend to see longer hospital stays for individuals who are hospitalized, more complications associated with surgeries and longer recoveries following surgeries. Also, individuals with a lower muscle mass and who've lost a lot of muscle mass and weight in general, they do tend to have more significant side effects to their treatments, for example, like chemotherapy. And survival times can also be impacted as well. So all in all, I think I hope that I've really stressed the importance of maintaining muscle mass, preventing muscle loss and weight loss for a number of these different reasons. So the question is, what do we do about it? What kind of control do we have in preventing and reversing muscle loss? Because, I mean, of course, there are a number of different factors at play here that can help support this, but I will be talking to my expertise when it comes to nutrition. Because nutrition does play an absolute critical role in preventing muscle loss. And it's something that I feel is oftentimes overlooked. I feel in many instances, the conversation about the importance of maintaining weight and maintaining that strength before treatment starts and during treatment, it needs to be discussed more. And in making sure that individuals who have been diagnosed are equipped with a team and tools to help them. And nutrition, it plays a big part. And not to oversimplify things, of course, there are a number of different nutrients that we get from food that fuel our body well and that are important for good health. But if I were to be put on the spot and I had to pick one specific nutrient that was above all else the most important nutrient to help maintain that strength and that muscle mass, 100% it would be protein. Okay, protein it's the building block for all of our cells and the muscles that make up our body. And without enough protein, our body suffers. So we need to be making sure that we are fueling our body in a way that will set us up for success. And getting enough protein is a very, very important part of that. Now, it's not to say that it's easy to get enough protein, because for anyone who has gone through treatment or knows someone who's gone through lung cancer treatment knows that it can be very, very difficult. And this is where working with a dietitian can help really individualize your care plan, individualize what is going to work for you as far as nutrition recommendations and an ongoing follow-up during the treatment to make sure that you are doing as much as you can to set yourself up for that success. Perfect. Now, again, those barriers, because if getting enough protein was easy, well, talks like this wouldn't be necessary. And, dietitians wouldn't play as big of a role as they do for people living with cancer. Because the side effects of lung cancer treatment can vary so significantly from one person to the next, of course, depending on what treatments are received. Now, we know that this can be a combination of surgery, chemotherapy, radiation, immunotherapy. There's a wide gamut of options, and side effects will, of course, differ from one case to the other. But it's just to say that the few side effects listed here on the screen, these are some common examples. And some of these side effects may be worse than others. Some people may experience all of them, leading to more difficulties fueling our body well and getting that protein in. Now, whether it's due to the pain of a growing mass, our cancer mass, maybe it's the radiation effects. So that could look like increased fatigue, a burning sensation, really, really bad irritation of the esophagus can occur when we're receiving radiation to the lungs. And of course, chemotherapy side effects can vary from taste changes to nausea and vomiting to bowel changes, and all of these things need to be evaluated based on what your personal experience is. So if nausea and vomiting are the main issues, how are you going to be eating working around that? So dietitians do play a really big role in collaborating with the medical team. So whether that be your medical oncologist or your clinic nurses or your chemo nurses, we work very, very closely with the team to ensure that from a medical standpoint, we're doing everything that we can to minimize and manage these side effects. Because the reality is if these side effects are not well managed, eating, getting that protein in and fueling our body adequately, it just becomes this impossible uphill battle. So that's where individualized care and individualized nutrition recommendations are incredibly, incredibly important. And again, when it comes to individualized nutrition care, it's all about the follow-up. When I meet with someone for the first time, perhaps they were sent to me by their oncologist because they've noticed that their weight has gone, down since their last chemo treatment, and they're having a really hard time eating. So it's getting to know my patient, getting to know, okay, what's going on? What are the main symptoms and side effects of your treatment that you're experiencing? And what in particular is affecting your ability to eat well? That's where we come up with a plan. All right. There is no one size fits all when it comes to nutrition and nutrition recommendations. You can't just give someone a piece of paper and send them on their way as far as nutrition goes. It needs to be one-on-one, individualized, and there's got to be that opportunity to come back to the drawing board to figure out what's working, what's helping, what's not, and how do we go from there to help improve your overall nutrition? Because at the end of the day, that is our main goal. Now, although I said there is no one size fits all approach, which I stand by that is absolutely true. I do find that there are some strategies or some recommendations that can be not universal, but that can be applicable to a number of different people. And this again is where these are some examples. And I did want to pass through each one just to kind of get a sense of, why and how it could be helpful. Now, first off, small, frequent meals and snacks, I would say is a recommendation that I offer, I suggest on a regular basis, to my patients and clients. And it's because for many, our appetite just isn't there. And whether this is due to active treatment or the cancer itself, appetites and our interest in food tends to take a dip. And this is where we need to make the most out of every opportunity that we have throughout the day. So for someone who maybe prior to their cancer diagnosis was having two big balanced meals where they were getting in a lot of calories, a lot of protein at their two meals, and maybe that was enough for them. But now, following their diagnosis and the start of their treatment, they're noticing that their portions are cut in half. I mean, they're maybe not even able to get half of what they usually would get at a meal. In instances like this, if we continue on with our same routine of simply eating twice a day, there is no way that you'll be able to get enough calories and enough protein at those two occasions to be fueling your body well during your treatment. So the frequency and the schedule, how often I'm including snacks. Maybe it's more of a grazing schedule rather than focusing on big meals if I'm just not able to get the amount of food that I need in at one given opportunity. So this is something that I do find incredibly important, is to go over your daily routine and see where we can add a snack, where we can add some nutrition in. And that kind of snowballs into the next point of making each bite count with nutrient dense foods. So again, if my portions are more limited because I'm feeling fuller quicker, maybe I just, again, the appetite just not being there. This is where I want to be strategic. I want to be really smart about my choices and making sure they're as nutrient dense as possible. And that kind of encompasses high protein foods and high calorie foods in one. So, for example, if I'm sitting down for my afternoon snack and I know that I'm only going to be able to handle maybe like a half a cup portion because I'm just really not feeling hungry, I'm going to make sure that what I do choose on my plate is going to pack in as much protein and as many calories as I can. Okay. Now, as far as some of the guilt that a lot of my clients and patients experience is when they tell me that they feel bad that they don't have the energy to make as many homemade meals, or they're choosing maybe it's takeout, maybe it's frozen meals or convenient ready-made meals. And it's to remind everyone that these options can still be very nutritious. And sometimes they are the best option and the only option that we have for a number of reasons, whether it's because our energy levels are much lower than they previously were, and going for convenience becomes the number one most important thing. If it's not convenient for some people, it's the meal or the snack is just not going to happen. So it's just to remind everybody that quick, convenient, ready-made options can still be nutritious options. And there's really no room for any guilt or any shame around our food choices when it comes to nutrition during a cancer treatment. I realize as well that energy levels will fluctuate. There are days where we will feel better. There are even hours of the day that we may feel better. Maybe morning is best. Maybe afternoon is when you get your second wind. And that's where, again, we want to make it count when we feel our best. Because generally speaking, if my energy levels are better and I'm feeling a little bit better, I'm more likely to get a little bit more nutrition in at that specific time. So it's remembering that it may be a little bit of a roller coaster depending on when your last treatment was, depending on a lot of different factors. So just knowing that looking at your day to day and kind of looking for patterns as to when you're feeling your best might be a good starting point to optimize your nutrition at that time of day. Now, our preferences may change a lot during treatment. And again, that can, be due to different side effects experienced from the treatment itself. But our taste preferences, sometimes there doesn't seem to be any rhyme or reason, but certain flavors are better and certain flavors can be incredibly off-putting. I know many of my clients and patients tell me that they struggle with taste changes. Maybe it's like a metallic taste from their chemotherapy, or perhaps just food is tasting very, very bland. And when food lacks flavor, oftentimes our interest in eating starts to go down. So we start eating less at a meal because it's just not tasting good. It's just not giving us the flavor that we're looking for. So at the end of the day, we need to be open to experimenting. different ways of seasoning, different ways of adding a punch flavor. And that may look different than what our typical ingredients and way of cooking looks like. But I do find that having that open mind and experimenting really, really can be helpful. And then as far as maximizing that energy and protein, it's not just looking at our food choices that matters. Oftentimes, it's kind of broadening the horizon and looking at our beverage choices as well. So, what am I drinking? And can I include options that will bump up that protein and that calorie intake, which is, again, at the end of the day, the optimal goal for maintaining our strength, muscle mass, and just keeping our weight as stable as possible. Now, that may look different for different people. It might be a homemade smoothie made with, full fat Greek yogurt and peanut butter. Maybe it's a commercial product that you bought at the grocery store, a protein drink. Maybe it's a protein powder that you're adding to a glass of milk or a glass of water. And maybe it's products that are medical products, things like Boost, Ensure. These are some name brand options, of course. There are many, many different options, store brands. I know different pharmacies and grocery stores carry their own. And these medical products, there's definitely a time and a place for them where they can be very, very helpful for reaching certain nutrition goals that a person may have. So all of that to say is that we've got options. We've got different strategies and different ways of optimizing nutrition. And what works for one person might not necessarily work for somebody else. And that's to be expected. We're all different. Every single person going through a lung cancer diagnosis and treatment may have a different experience. But when it comes to nutrition, this is where a dietitian can help you pinpoint certain strategies that you may not have thought of yourself and that may prove to be really, really helpful for you. All right, so on the slide here, I have what I call my smart swaps. And this is just a term that I've coined. It's essentially looking at your usual options, your go-to choices, things that you gravitate to at the grocery store or at home, and looking if there is a similar type of product that may provide significantly more calories and protein, which at the end of the day is exactly what we're looking for. And these are just some examples. And sometimes, sometimes I'm in my office with someone and we're kind of going through what their usual diet looks like. And I'll highlight certain things to kind of bring up to see, okay, would you be open to swapping this out for something else? And sometimes it's a hard no. Sometimes people don't necessarily want to change everything in their diet, and that's understandable. We want to try and make some changes that at the end of the day, at the end of the week, will make a significant improvement. So these are some examples. And you may see some of these things and say, I don't know. But anyways, I wanted to have a variety. I wanted to have some snack options, which I know a lot of people are looking for, different snack choices that might give them a little bit more of the nutrition that they're looking for. I had someone the other day in my office say that Mr. Noodles was all that they wanted. They liked the convenience, they liked the salty flavor, and it was just easy for them to get down. And that's understandable. When something is working for us and it is tasting good and we're enjoying it, oftentimes we don't necessarily want to change it. So my idea was, okay, we've got to keep it convenient, we've got to keep it simple, but a product that was very, very comparable. So it was still an instant noodle, it was still chicken flavor, broth. However, it provided 20 grams of protein for the same volume. It was just a different brand that they didn't necessarily notice at the grocery store before. So sometimes, again, a very, very simple change can make a very significant improvement. I had another patient who the flavor of lemon, that citrus flavor, was the only thing that was actually tasting good for her. And again, she was including things like lemon pudding, lemon popsicles, different things like there was lemon jello, lots of lemon. But again, a lot of her options were just really low protein and low calories. So this is where we did a little bit of digging and looked for a comparable type of product flavor wise, but something that provided a whopping 10 grams of protein per serving, which was these little individual cottage cheese cups, but that had a lemon flavoring to them, which for some people that might not be your cup of tea, and that's okay. Again, that's where working with the dietitian individualizes based on what your preferences are and what you're open to trying. Okay, again, other options going for a higher protein milk option, a higher fat, higher protein yogurt option. So again, a lot of it comes down to knowing what to look for on a label. And if you're comparing different products, it's giving people that knowledge and that confidence to be able to make those better choices for themselves. Now, sometimes it's not about swapping out products, sometimes it's about adding. And again, depending on the situation, it might be a meal, it might be a small snack, it might be a beverage, but looking at a slight ingredient addition that can help optimize that nutrition. So whether that's, scoop of peanut butter, a piece of cheese, a small handful of nuts that maybe we're adding to a snack that we were already having. And again, we don't necessarily have to do this all the time. I understand there may be times where we just want to sit and, have a bowl of popcorn or, a bag of chips and that's it. But this is where when someone is wanting to make that addition, these are some ingredients that could definitely help make the difference. On the other side of the slide here, different types of proteins that we could add into, a veggie or rice-based stir fry. I have an example at the top. I don't know if anyone here perhaps has already thought of this, but a lot of people don't necessarily love the taste or the texture of protein powders. So adding a protein powder to like a smoothie or a milkshake at home can sometimes be a really, really great way of adding that protein in. But not everyone loves the taste or the texture, and skim milk powder is a very economic option, a low price point, but still a way of adding that extra protein to something that perhaps you're already making at home. So again, little ways of adding. Again, when we're adding, it doesn't have to be a significant amount. Doesn't necessarily mean that we have to be eating a lot more volume, but it's more so being strategic with the types of ingredients that we're adding in. And I definitely I've had some clients and patients who are a little bit skeptical and kind of saying, Chloe, how much of a difference is this actually going to make? Adding a little bit here, a little bit there, like is this really going to be making much of a difference? And this is where I like to do a side by side and make that comparison. So this is one example, and of course this could be done to any meal or snack that you may be having. But this was just an example for a breakfast option. A slice of toast, a 1 egg or 2 egg cheese omelet with a beverage on the side. Okay, so there's absolutely nothing wrong with the option on the left-hand side. But if we're comparing it to the option on the right-hand side, we notice that on the right-hand side, we're incorporating ingredients that are boosting our calories and protein. So a little bit of extra butter, a little bit of extra higher fat cheese. Cottage cheese is a great add-on, by the way, for omelets or egg dishes. It's an excellent way of optimizing the protein, and it gives it a really, really nice fluffy texture. Swapping out our beverage option, again, it can be a very simple exchange. And at the bottom of the screen here, you'll notice the significant difference in calories and protein. Although the portion of the food consumed on either side is essentially very, very comparable. So it's not as if we're eating a whole lot more, but it's just being strategic with our ingredient choices, which at the end of the day can really significant the calories and protein. And this is just for one meal. If we were to do this on a regular basis and asking ourselves, okay, what could I add? What ingredient can I include to help optimize this meal or snack? That's where at the end of the day, it adds up. And that's where we can notice significant increases in our protein and energy, which again, the whole goal behind these efforts, because it takes effort to do this. It takes time, it takes thinking, it takes, extra time at the grocery store comparing products. So it's not as if these changes are always easy, but they are worth it. When we are consistent with these efforts, it can make a significant change in the end. And that is where, again, it brings us to stabilizing our weight, maintaining that muscle mass and that strength. Because again, for people who are in a better performance status, who are at a stable weight and who've maintained that muscle mass or possibly regained some of that muscle mass from their initial diagnosis, we are noticing again improved quality of life, improved mobility, improved survival outcomes. So this is what we're working towards. Now, accessing dietitian services might look different depending at where your cancer center is, what province you're in. We are very fortunate here in Ontario. Every cancer center is staffed with an oncology dietitian, or more than one actually. We're very fortunate here at our center. We have 4 full-time dietitians. And we see all different patients with all different cancer diagnoses, but we definitely see a very large population of lung cancer patients. And luckily, where I am, patients can self-refer. I know that's not necessarily the case for everywhere, but our patients don't need a doctor's referral. They can call our center, and as long as they have a cancer diagnosis, they are able to access one-on-one dietitian services, which is fantastic. And I don't know what that looks like for you, but what I encourage you to do is inquire, ask. Ask how to access a dietitian. If you are someone who is struggling with weight loss, who is noticing decreased strength, worsened mobility, or just feeling more deconditioned and fatigue. Maybe you're dealing with a number of different side effects from your treatment that are making eating more of a challenge. Don't wait. Ask your doctor, ask your team, whoever you are connected with at your cancer center, ask them how to access dietitian services, because it could make a significant positive impact. And that's it. That's what I have for today. So I really hope that there were some tidbits of information, some little pearls that you're able to take away to implement in your day-to-day, in your routine, or again, maybe a friend or a family member who is perhaps struggling during their treatments. So again, I thank you all for joining, and I think Michelle was going to be opening up the question and answer period.
Yes, thank you, Chloe. Very informative. I had the pleasure of hearing a shorter version of this talk when you spoke at our patient summit, and thank you for coming with us today and expanding on it. If anybody would like to ask more questions, you can put them in the chat, or now that the presentation is done, if you'd like to just raise your hand and you can speak, I'll grant permission to speak, and we will take it from there. So some of the things that came up, Chloe, when targeted therapies or treatments make you gain weight instead, is it still a good idea to follow these tips?
It's a really good question. And although I can't provide any individualized recommendations, because there are many factors that can contribute to weight gain during treatment, whether it is extra fluid retention or something in that regard. Perhaps it's a medication side effect. Perhaps it's related to steroid use. There's a lot of different factors that can definitely contribute to weight gain during treatment. The importance of maintaining adequate protein intake is still top priority. Now, our recommendations for adding more calorie dense foods, perhaps things that are higher in fat, might not be as appropriate. But I do feel that the protein, the specific protein requirements are still elevated regardless. But that is something that would be a really, really great question to talk to your doctor about. And again, if there is a way of connecting with an individual, with a dietitian for some individualized recommendations, I do think that would be incredibly valuable.
Thank you, Chloe. The other second question, is there any truth to the saying that sugar feeds the cancer?
Very good question. And this question, I'll be honest with you, it comes up in conversation probably on a daily basis. I'll be very, very honest. There is so much misinformation about sugar and how it feeds cancer cells in the media, online. Essentially, I feel like it's coming from every angle. And I feel so much for people, with a cancer diagnosis going, trying to navigate information because there's so much misinformation out there when it comes to this topic in particular. To summarize and to kind of simplify things is sugar comes in different forms. There's natural sugar, there is added sugars, but at the end of the day, when our body breaks it all down, the most simple form of sugar is going to be our glucose molecule. Okay, glucose is the smallest particle of sugar that we use for energy. And glucose is used by every single cell in the body. Our healthy cells as well as cancer cells use glucose, and it's the primary source of energy that our body utilizes. Now, the big difference here is the way that normal cells use glucose and the way that cancer cells use glucose. Cancer cells, and again, this is overly simplifying it. There's a number of different types of cancer cells, of course, but they use more energy. They're kind of like gas guzzlers, right? They use a lot of energy. So it doesn't matter what we eat, whether we eat a balanced diet, lots of sugar, lots of protein, little bit of protein, those cancer cells are going to get the energy that they need to divide and replicate and do their thing. There is no way of starving a cancer cell with our diet. We rely on treatments to target the cancer cells. Our diet, there is no research to show that a specific diet will target or kill cancer cells. So the importance really lies in fueling our healthy cells. And, a diet that's comprised solely of sugar is not a good thing, of course, for a number of reasons. We want balance. We want carbohydrates, fat, protein. We want a combination of these nutrients. But to say that sugar feeds cancer cells and makes them divide faster or spread faster is absolute misinformation. And again, it's not a whole lot of time. I could have a whole talk just on that, but I hope that you kind of get the gist of what I'm trying to convey.
Thank you, Chloe. And now Beverly has a question. So Beverly, I'm going to open up anything and allow you to speak.
Oh, thank you, Michelle. Chloe, I've had exposure to nutrition in the past, many years ago, but your presentation was so informative and straightforward and relevant and excellent tips. So I can't thank you enough. It's
Well, thank you.
I think you should speak to every single Canadian lung cancer patient. And, I don't think we all know this stuff. If I could just ask you, what are your thoughts about water? And I feel drinking water on a daily basis, I feel we're exposed to a lot of toxins. And I think it's important that we emphasize water. So I'm tall and big and I'm very active. So I drink 2 liters of water, which might be high for others. But what are your thoughts about water?
Absolutely. I think it's an excellent, excellent point. Water, above all else, is the most important hydrating beverage that we should be including on a regular basis. Everybody, our body needs water. Our cells need water. And everyone's water needs are going to be a little bit different. I know that for the general population, recommendation that is oftentimes discussed is, 6 to 8 cups of water, which would be about 1.5 to 2 liters a day. Now, that may change depending on our activity levels, depending on certain medications that we're taking, certain chemo treatments that are harder on our kidneys, and ensuring really, really optimal hydration is incredibly important. So water, absolutely, it is incredibly important. Everybody should be including water in their day-to-day and realizing there may be times where we need to be increasing our water. But I think that's a fantastic point, Beverly, and thank you very much for your comment.
Thank
Thanks,
you.
Chloe, and thank you, Beverly. So did you have a follow-up, Beverly?
No, no.
Oh, okay.
Or no, I was just saying thank you. Oh, shut up.
So the next question is, my husband used to eat egg whites only in fried eggs. Should I encourage him to eat egg yolks?
So the egg yolk is going to provide more of the fat and certain micronutrients that we don't necessarily get in the egg white. Now, again, depending on, some people don't like the taste of the yolk. There may be specific reasons why someone would just want to go for the egg whites. But I do think including the yolk is a good way of adding a little bit of extra fat and a little bit of the extra micronutrients, again, that we're not getting from the white. So I think a combination. And I know some people will do a combination of both. If they're doing like an omelet, they might do a whole egg, and then they might add some of the liquid egg, like the white part of like the cartons of the egg whites that they may add in. So I think both are good, but I don't think there would be any specific reason why we would necessarily have to avoid the egg yolk unless there was a specific reason that was discussed with the doctor. Of course, I'm not able to provide like individualized recommendations, but as a whole, both are absolutely fine to include.
Thank you. And our next question is about protein powder. How should we choose a protein powder? There are many products on the market. I have trouble navigating the options, not knowing what makes one product better than another.
That is a fantastic question. And I know that it's something that so many people are struggling with because the choices are endless at this point. You can find protein powder sold at your pharmacy, at Bulk Barn, at Walmart. Seems like the options are truly endless. There's three big things that I look for when I'm looking at a protein powder. I want it to be a complete protein. Okay, so there are some protein powders on the market that are not a complete protein. And what I mean by that is protein is made up of amino acids. Okay, there's a number of different types of amino acids. And for it to be complete, it has to include all of those amino acids. So a complete protein is something to look for. There are some protein powders that will have flavoring, some won't, some will be unflavored. I think that really comes down to a personal preference. Okay, there's nothing wrong with a flavored protein powder. Again, preference is key there. There are some protein powders that will have a nasty aftertaste that will be very, very gritty as far as the texture. So that kind of preference, again, a lot of it comes down to trial and error, which is hard because a lot of protein powders are large formats and they're expensive. They're not cheap. So a lot of people aren't necessarily going out to buy a lot of different options. One of the more nutrition side of things when it comes to choosing a protein powder, I personally would recommend a third-party tested protein powder. The reality is that like a lot of nutrition products, we don't always know what's in them. So having it third-party tested, essentially it's like an extra layer of confirmation that a nutrition analysis has been done. There's less of a risk of heavy metals or additives that we don't necessarily want in our protein powders. And then the last point that I would suggest looking for is keep it simple. A lot of protein powders, especially ones that may be sold at like specialty stores. I know in Ontario, like Popeyes or GNC, these are stores that have like wall-to-wall different options. But a lot of them will have extra additives. Maybe it's extra creatine, maybe it's extra caffeine, things that are geared more towards people who are doing intense physical activity or like a pre-workout that could be added in. I would steer clear of that. I would look for a simple ingredient list. Some of them will include artificial sweeteners, some of them won't. Again, I think that both can be fine, safe options. It really just depends on the preference.
Thank you, Chloe. Can I ask, how would we tell that a product has been third-party tested?
There would be a symbol at the bottom. So that's something to look out for.
Thank you. Thank you. That's all the open questions that we have. If anybody has, we probably have time for at least one more question. If anybody has any, you can raise your hand or place it in the question box. Okay, so if that is it, I'll just follow up by saying that I'm sure all of you now want to book an appointment with your oncology nutritionist. Most centers do have nutritionists. If you have any issues, if you can't self-refer or you're having any issues finding one or locating one in your area, you can contact me. Most of you know me, but if you go on the website, you'll see you can email me at info@lungcancercanada.ca or michelle@lungcancercanada.ca, and I'll be happy to help you with that in that search. Thank you, everyone, and thank you, Chloe.
Thank you so much for having me, and thanks everyone for joining.